Hi guys, I'm just waiting for Dr. Tapan to come on and join me. Got a great audience so far already. Thanks for joining, guys. Okay, great. So I'm just going to add Dr. Tapan in. He should be live with us shortly.
Hello, hi Priya.
Hi Tapan, how are you?
I'm really good. Good evening. Good evening, everybody.
Hi everyone. So thank you so much for doing this with me, Tapan. That's it should be a really good session. I think what we'll do is we'll just wait for a few more people to join.
Sounds good.
We've got people joining thick and fast, which is great.
Absolutely. Yeah. Thank you very much for the invitation. It's a great idea.
Yeah, I think so. You know, we can't, like I was saying in my post, we can't do as much aesthetic practice as we'd like during lockdown, but at least we can still talk about our treatments and sharing the knowledge.
That's right. Just prepare, you know, make hay while the sun shines, as it were. Priya, just wanted to check, are you recording this? Because I had a lot of requests from people who can't make it because of time zones. So is it going to be recorded and on the Instagram page?
So I think at the end it will give us an option to save this. So I'll make sure that I save it and then upload it to the Endolift page, but then you can share it to my page or your page afterwards.
Sounds good. Sounds good.
So, yeah. Okay, so got a fair few people watching. So I think we can make a start now.
Sure.
So for those of you, there's a lot of people who are familiar in the audience watching and those who are not. So for those of you who don't know me, I'm Dr. Priya Verma and I'm an aesthetics doctor here in the UK. I'm also an NHS GP and I'm the key opinion leader for a treatment called Endolift, and that's going to be the topic of discussion this evening. Tapan, you don't really need an introduction.
No.
So Dr. Tapan Patel, you are a global expert in the field of aesthetic medicine. So thank you so much for joining me. And you've been doing the Endolift procedure for a little while now as well. So
sure.
This session is really about kind of talking about what it is and finding out really what your experiences have been so far with the procedure. And then just kind of having an open discussion. If we get any questions from the audience, we can try to answer as many of them as possible as well.
Sounds good to me.
So because I'm not sure whether we've got, I assume we've got a mix of both clinical and non-clinical people joining us this evening, probably some patients, some doctors who are interested. So what I'll do is I'll just start, guys, by telling you a little bit about Endolift, so what it actually is. Now, Endolift is a laser-based procedure, an aesthetics procedure, which is completely non-surgical, and it can be done in a clinic-based environment. And it's got two main aims. So the first is to improve the degree of skin tightening in patients, both in the face and the body. The other thing that it can do is to reduce the amount of excess fat, provided they are small pockets of stubborn fat in, again, the face and body. Now, the way it works is that what we use for Endolift is a very, very thin microfiber. It's a micro-optical fiber, which is about the size of a human hair. So really, really quite thin and non-invasive. And what we do is we insert this fiber underneath the skin into a layer of the skin called the hypodermis. And once we're at the correct depth, what we do is we start delivering the laser energy. Now, that laser energy will heat the tissue, and through heating the tissue, it kickstarts a process of making more collagen. Now, that collagen production comes from us kind of telling these cells to switch on, these cells called fibroblasts. And so what we're doing is we're increasing the amount of collagen production, which then in turn will help with issues such as skin laxity that a lot of our aesthetic patients come in with. Now, the other thing is that we can also do a degree of fat melting, and the beauty of the treatment is that, unlike conventional procedures, what we do with the heat of the laser, we are melting fat cells, but we don't actually need to remove manually any of those fat cells or suction them out. What we do is we rely on our body to clear away those sort of opened up dead fat cells, and they just excrete out of the body through the lymphatic system. So you've got two benefits, really. If you've got a stubborn pocket of fat, for example, under the chin, but you've also got a degree of laxity, not only are we taking away that fat, but we're not leaving you with excess saggy skin, we're also tightening up that skin with Endolift. So that is, in a nutshell, kind of the two main objectives of the treatment. Now, in terms of the procedure, what most people want to know is it painful? Does it hurt? And in my experience, what I found is if you use a very small, controlled amount of local anesthetic, patients can be very, very comfortable, and it can be virtually painless throughout. So, patients are tolerating it beautifully, and actually the results we're seeing are, they speak for themselves, and you might see some results on my page and also on Tapan on your page in the future, and also this Endolift page, so you can see some examples of the type of skin tightening and fat melting that we're achieving. It's been around quite a long time, but it's fairly new to the UK, and it's been around in the UK for about 2 or 3 years, but actually the treatment has been around itself for about 12 to 13 years, originating in Italy and founded by a wonderful company called Eufoton, who have worked relentlessly to kind of develop the protocols, improve the caliber of the fibers that are used, so that now worldwide, where it's being used in 26 countries, it's actually, at its most optimum. And I hope that, you and I, Tapan, and also other practitioners worldwide who are using it can collaborate and really add to that evidence base to try to improve the knowledge that is out there of this treatment, so that we can better, the delivery of the aesthetic treatments we give for our patients.
Absolutely.
So that's in a nutshell what it is. So that kind of kickstarts our conversation. What I'll do now is Tapan, if you don't mind, I think what people really want to know is, from somebody who is, a leading aesthetic doctor who has a wealth of experience and insight into various aesthetic treatments, we really want your opinion. How have you found, since using Endolift, how has it fit in with, your aesthetic practice, and has it kind of satisfied any unmet needs in your clinic?
Great. So first of all, fabulous introduction, really summarized the key points there. And I have to say, Priya is a fantastic teacher. She trained me in this procedure a few months ago, and it was without doubt, the best aesthetic training I've had. So it was, really, really good. The procedure is very intuitive, but let me start from the beginning. What is the unmet need? So Priya, I mean, you know me now, but I can get carried away talking. So anytime you want me to just literally do that, and I'll hand back over to you. But look, what was the unmet need? Aesthetics grew very spontaneously. It's certainly in this country, around the millennium, 99, 2000, something like that, with the advent of Botox, this whole medical field of medical aesthetics started to grow. And it started growing in lots of different directions. And, people were doing Botox, people were doing dermal fillers. And what a lot of people may not realize, around the same time, the injection lipolysis treatment started happening, etc. Now, lasers and so forth took off quite late in England, certainly. They're much better uptake in America, continental Europe, etc., Asia. So what was happening is, certainly there was a lot of practitioners who were just doing injectables as part of their aesthetic procedure. And there is that saying that I've used so many times. Anyone who knows me has probably heard me say it 100 times, that if the only tool in your toolbox is a hammer, everything starts looking like a nail. So you start using that hammer to treat anything. You want to break wood, you bash it with a hammer. You want to, chisel something, you try to do it with a hammer. And that was the problem. And I think we all knew that there are indications on the face where it's just stupid to use injectables, and I think for me, And I'm guilty of this because at a time when we didn't have anything else, for me, the number one indication is this, the jowl, okay? And I often used to say to my patients that, you know, if we're going to try and treat this with injectables, we're not treating it, we're disguising it, either by treating the overactive DAO muscle or by, you know, trying to lift up the skin, or maybe there's a little elevation in the jowl here. So we may put the filler in front, behind, whatever. And look, yes, in some people it works, but it's very few compared to the amount of people who come in wanting improvement in the jowl. The number of people who truly benefit from injectables is very little. If I had to put a mathematical estimate, I'd say less than 2%, okay, of people who I feel, and it's just those with very mild jowling, little bit of skin laxity, maybe benefit. What about everybody else? Yes, there is surgical options, but you know, we know, being in non-surgical aesthetics, that that barrier, that obstacle to having something surgical is huge for a lot of people, understandably. The downtime, the risk, the expense, etc. is there. So I think for me, there was this very unmet need of how to treat skin laxity and, in many cases, a little bit of extra fat that we all accumulate around the jawline, submental, that's the area under the chin. So I have to keep reminding myself there'll be a lot of patients listening, so I'll try not to get too technical. If I do, just put a comment saying, you know, talk in English or something like that. But essentially, people who have a little bit of extra fat under the chin, bit of extra fat on the jawline, sagging skin, if you try and treat that with anything other than surgery, it's disappointing at best, in my opinion. The Endolift really was something that I think I was waiting for a number of years before I even knew it existed. And so, of course, when it came along, you know, I was rather excited. As always, we have some healthy skepticism, you know, because companies will often show their best photos. People will often talk very, you know, big about something new. So I have to say, I was very impressed with your feedback of it, Priya, when, you know, when you did my training. And, you know, moving a few months on, I don't know exactly how many treatments I've done, but it's north of 20, could be about 30, maybe. So, so far, the patient feedback has been excellent. Glad to say, you know, when I buy a new device in the clinic, and it's probably worth mentioning that over the last 10, 12 years, I've bought more than 50 systems, okay? That's literally every laser known to man, or certainly every wavelength. So lasers, radio frequency, ultrasound, plasma, microwave, all those devices sit in the clinic. And I have two reasons for buying a device. Number one, it must be safe. Number two, it must work. But out of those two, the safety is the more important, okay? I can still accept a device that may not achieve what it sets out to do, but I can't accept a device that's causing damage and complication. There's quite a few of those. So when I looked at this, of course, when it's so difficult to describe Endolift as being invasive, because although it is under the skin, it is literally as minimally invasive as possible. And what I explain to people is the most invasive part of it is putting the anesthetic in. Okay, when we put the anesthetic in, we're using cannulae. We're using the same cannulae that we would use for dermal fillers, okay, in a very subcutaneous plane. So it's not even deep. So actually, that to me is the, you know, the most invasive part. And then that fiber, as you described so elegantly, is such a thin hair-like fiber, and you know, it's so easy to sort of guide. So to me, I think the unmet need was that patient who wants to have a non-surgical, I hate using the expression lunchtime procedure, but it is a lunchtime procedure, you know, start to finish. It's under an hour. And that's when the patient walks through the front door to when they leave. So, you know, it is like that. Now, you know, as always, patient indication and patient choice is important. And it's one of those things where we have to be clear that if somebody has a lot of skin laxity, if somebody has a lot of adiposity, then maybe something more dramatic will be required. But out of my 25 to 30 patients I've treated so far, not one complication, And the patient feedback has been excellent. Now, some of them were only treated maybe in December, you know, in the first couple of weeks of December. So we haven't even got to the 4-week mark, or we're just getting to the 4-week mark. But, you know, I stay in touch with everybody, you know, wonders of modern technology. So I can FaceTime people, and, you know, people are having, so Dr. Tosh is asking, can we have the procedure at breakfast? Listen, you're in Australia, aren't you, mate? I think you can have it whatever time you want. Yeah. So
absolutely agree. I think, you know, I've done in excess of about 70 treatment areas now, and I've had very similar client feedback. Patients are very happy. Not only, so first thing is that they're very comfortable during the procedure, and afterwards they're like, gosh, I didn't realize it would really be so straightforward. I didn't feel a thing. And they can feel, often they say, I can actually feel the skin tightening straight away. And so, you know, I've had the opportunity to get patients back at, I have a protocol where I get them back at 1 month, then at 3 months, and then at 6, somewhere between 6 to 9 months.
Yeah.
And what I'm finding is that it really does give you very gradual improvement. And that is, again, another advantage over, you know, conventional surgical options, because patients, I find now increasingly, do not want to transform in a drastic way the way they look. They would like to have some kind of subtle improvement, or they just want to have something where they go unnoticed, under the radar. People don't really know what they've had done, but they know that they look a little better, or they look like they're a bit more refreshed. And so, well, anyway, that's what my patients have been requesting. And so what I found is that, you know, we'll do the treatment. There'll be, in most cases, some immediate retraction, so some immediate skin tightening, despite the fact that they might have a little bit of inflammation, a little bit of redness. You know, despite looking through that, you can still see there's evidence of retraction straight away in most. But then what's very interesting is you bring them back in a month, and I sit them down, and they're in the consultation, and we've not taken the 1 month photo yet, and they say, oh, you know, I'm not sure I've seen a huge difference to that initial retraction. It kind of dropped a little bit after about a week or so, or a few days, and I'm not entirely convinced that I've seen a result yet. Then you put the kind of before photo and the 1 month after photo next to each other, and it's a dramatic improvement. And, you know, if you look at it with an aesthetic eye, you can see there are subtle shadows that we look at, where we can see an enhancement. And actually, if you guide the patient to what you're seeing, it's amazing kind of to see how, yes, subtle, you still very much look like yourself, but there has been an improvement. Then we continue to build on that. When I bring them back at 3 months, again, there's even further improvement. And, you know, it's really important as well to say to patients, look, to manage your expectations, this is a treatment that you will have to wait to see your result, and there's a scientific reason for that. Actually, you know, there's a reason why I say to patients that it could take up to 9 months to see your final result. And the reason is because, yes, you're basically switching on a process of the production of more collagen, but that process takes time. Now, first there's, you know, the first step, which is, let's make these cells which make more collagen, let's switch them on. Then the next process is the production of collagen, and that production of collagen, well, it happens slowly, and then when it does happen, collagen is formed in a naive protein form. Then you've got to allow time for that collagen protein to mature. So when mature protein, it has much greater tensile strength, we call it, and when I describe that to patients, I say it's got much more ability to kind of act as a scaffold under your skin, to kind of hold your tissues up in a retracted state for longer. So, you know, we can switch on the process, but we certainly can't do very much about how long that collagen maturation process takes. So, you know, I always say it's important to explain this to patients, because then they know why it's taking so long. It's not just we're trying to say, oh, you know, maybe at the next review we'll see a result, maybe at the next one, but it's actually that there's a serious scientific underpinning as to why it takes that long. And you probably find the same thing when you do follow them up, Tapan. If you've been doing it for 3 months, then you'll see them at 6 months. You'll see that gradual improvement.
It gets better and better. Yeah,
absolutely.
A few questions have been coming in, so let's just quickly address those, because a lot of them are similar. So just the ones I can remember, the last 3 or 4. So apologies, guys, because they come in and then they go. So if we don't remember them, apologies if we miss them, but I'll try and remember them. So somebody said, how long do the results last? this is a good question, because what I'm starting to tell my patients is that, look, the problem with any procedure and saying how long does anything last, with the exception of Botox, which you can almost set your watch by for some patients, but with everything else, the problem is that there is a limit. There's a time that the procedure would theoretically last, but we continue to age. So, and we age at different times. So you took someone on January 2021 and you treat them with the Endolift, it's going to have a certain length of time. But what is that person doing with their lifestyle afterwards? So for instance, if you've used it to slim the face, that was another question, and yes, you can. But if you've used it to remove the fat from the face and you've got a result. Now, if that person maintains the same level of lifestyle, physical activity and diet, you will get years of result. But if they're, for instance, go on an eating binge and, start putting in 500 calories a day extra over that time, and they put on physical weight, well, weight can be put on anywhere. So if you put on 5 kilos, 10 kilos, and at some point when I'm brave enough, I'll share with the cyber world of Instagram my own photos that just show the change in my own face, just with weight gain. I haven't had the procedure, but just with weight gain and weight loss, I look like two different people. Literally two different people. So the thing is that's why it's difficult to say. Now, somebody asked about collagen supplements. This is one of my favorite questions, that do collagen supplements help? Look, there is a little bit of evidence for collagen supplements. There is a little bit. But I would say it like this: if we just go back to medical science, when we eat anything, our stomach breaks it down to its most basic components. So, if you're eating potato, which is starch, it's still broken down to sugar for that sugar to be absorbed, glucose. In the same way, protein is broken down into amino acids, which are then absorbed and then used to build whatever, your biceps or your collagen in your face or whatever. So when you take a collagen supplement, is it really, people say that you take the collagen because it will travel straight to your skin. Sorry, it can't do that. It's still broken down by your stomach acid. The analogy I often give that makes people laugh is like saying, if I want to get, big pecs, I should eat chicken breast. But if I want to get big thighs, I should eat chicken thigh. It doesn't work like that. Chicken is chicken and beef is beef and tofu is tofu, and, but they all are protein. And that's what collagen is. Collagen is simply protein. So look, if you like taking collagen supplements, some people do, go for it. I don't think anything bad happens. Does it improve the treatment? I don't know, but I'm not 100% convinced that, that's something that would make or break the treatment. But what I think what's more important is, I think, as Priya said, is patient selection, but also explaining that those results, anything to do with collagen, the minute you hear it, it's not an overnight, an over day, an over week, or an over month result. It's 3 months. Collagen production is 3 months and then ongoing. So I think getting patients to understand that's important. And I think what you're saying, Priya, is so true. With a lot of these treatments, be it laser resurfacing or anything, where there's immediate swelling, people see that result. So, swelling or, that contraction. But then over a period of time, there's no doubt that people get better initially, then worse. And that's important to understand, that sometimes people look the same as they did before or even worse, and then it slowly builds up to get better and better and better. And I've lost count of how many people, I can relate that experience to, where initial improvement, yay, everything's good. Disappointment, I don't think this worked. And then 2-3 months, that's the result. So yeah, perfectly put.
Absolutely. That's why, an important part of the consultation is managing the patient expectation and going through all of these factors. While you were speaking, Tapan, I was just making a note of a few other questions that people had. Someone mentioned that it's a fairly expensive treatment. How do you convince patients to, or, advise patients to go ahead, given they have to wait so long for their result? Well, ultimately, what I would say to that is, you are getting in a lot of patients, depending on how you select your patient, if you choose the right people to do this treatment on, then you should theoretically see a result. And if you're adopting the right technique and you're using the right approach, then yes, you should see a result. Now, like we touched on before, there's a lot of patients out there who want to have results akin to a surgical facelift. And I'm by no means saying that Endolift is like a surgical facelift. It's not. But what it does give you is the benefits of having an office-based procedure, something that has very limited to none downtime. You know, the majority of my patients leave the clinic and are able, if you know it wasn't for working from home all the time during lockdown, during this pandemic, but they would be able to go straight back to the office or go out for lunch or go about their daily duties without really having looked as though they've had a treatment done. And so, you know, it's got that advantage. You know, it doesn't have the downtime, it doesn't have the complications of having a surgical procedure. So, and also, like we discussed, you know, the transformation is very gradual, and so a lot of people are seeking that out now. So I think, you know, you really shouldn't be needing to, you know, push hard for a patient to have this treatment. There are patients who want this kind of treatment, and then there's others who don't. There's others who want a more quick, faster, and more permanent treatment outcome. Yeah. So Endolift is probably not for them.
There is another point, and I'll just say a quick hi to my friend Lily, who's joined us. But you know, there is another point here that, okay, if I take you back to, and apologies for some who are just joining now, but the idea was that if somebody comes to see me and the main issue is jowling, that's, you know, the number one thing. And by jowling, you know, sometimes people will say, I don't like this bit, but ultimately it's because of this. Look, that's what's happening. Okay. Yeah. Whether it's in that direction, that direction, that direction, it's a combination of laxity, and it's a combination of a little bit of excess fat usually. Now, in the days when I tried to treat this with filler, it would not be unusual to use anywhere between 8 to 16 syringes of dermal filler to try and do it. Because to try and get the result, you would often have to treat along the cheekbone, in the area by the cheek, along the jawline, which can just suck up filler. You know, this is just like an abyss. You can put 3 mils on each side and not see it. It would need it in the chin, the front of the cheek. That's just in the deep segment. And sometimes we then have to go superficially as well. So what I have found is that when I'm doing the Endolift, you know, some of the patients will still need filler because it doesn't address the deepest compartment, the bone, etc. But you can maybe sometimes halve, if not quarter, the amount of filler that might be required for that type of patient and get a better result. And because the results, assuming the lifestyle stays the same, is fairly long lasting, over a period of time, that kind of initial cost equalizes. So, you know, what you're not paying in the filler, yes, you're paying for the Endolift, but for a much, in my opinion, more elegant result.
Absolutely. And going back to what you mentioned earlier, I think there was a question on it about how long does Endolift last. I find that the longevity is far greater than cosmetic injectable counterpart procedures like dermal fillers, Botox. Obviously, they all have their separate indications, but even things like high intensity focused ultrasound, HIFU, it lasts a lot longer. Why? Because we're actually delivering more energy in a much more controlled fashion, and therefore stimulating the tissue in a safer way, but one that gives far more efficacy in terms of a treatment outcome. So no, all really valid points. The other thing somebody had just mentioned, and given we're talking about fillers, someone mentioned earlier, can it be done if you've had filler? And so, I don't know, maybe you should answer that, Tapan.
Sure. Okay, so it's a great question. You know, it really depends where the filler is and how long the filler's been there and what you're ultimately trying to do. So let's go back a bit. This procedure is done just under the skin. When fillers first came out, they were called dermal fillers because, again, we were injecting them very superficially. We were, in those days, I'm talking 20 years ago, chasing lines. So if somebody had a line there, we would actually fill the line. Lines in the, we'd fill them. And that's because those fillers were suited to that. You know, those fillers initially were collagen-based, then the hyaluronic acid came out, and our treatment mentality remained the same. Probably about 10, 15 years ago, we realized, and especially as the filler, what we call rheology, or the property of the filler improved, we could use them for proper volume replacement. Now, volume replacement happens deep. So I'll give you an example. If I wanted to improve somebody's chin, I would place it, you know, if you feel your own chin and the bone, that's where the filler sits. So in front of that, you've then got a fat pad, you've got some muscle, some more fat, and then the Endolift is happening just under the skin. So I think if somebody's got deep filler, it's not a problem. If they've got permanent filler, 100% they should not have this procedure, because permanent filler can flare up with anything, even other filler. So permanent filler, I wouldn't advise it. But but if the filler is superficial and you want the result of that filler, so meaning, let's say you visited someone in Jan, they put the filler in superficially and you like the result, don't do Endolift, okay? Because in fact, in some clinics, these laser fibers are actually used to break filler down. Okay, and that's quite important. Now, I've been using it a lot because I've had a lot of patients come to me with, I would say, lips that have become deformed over time, according to the patient, because of the way the filler was done. So what happens is the definition between the white lip and the red lip has almost become blurred. It's become puffy like this, often with deep lines. So the laser fiber can be quite useful for this. I'm doing a lot of lip treatment now. And what I find is that initially the filler kind of breaks down, but then when you inject the lip with filler afterwards, it looks much, much better. So I think ideally you'd probably want to wait. I don't know, actually, I'm going to put the question to you. How long would you wait from Endolift to doing some dermal filler, Priya?
Good question. So like you mentioned, it depends. Does the patient want to, so there's two things. Patients who have had dermal filler treatment very recently and who are after some skin tightening as well with Endolift, the main concern is whether the laser is going to break down the filler. So then it's going to affect the kind of the result of the filler. The other very big kind of issue, the technical issue, is how is the laser fiber, how is the laser energy going to behave when it senses that there's a foreign body in place? Yeah. So I won't go into the technical details on this Instagram Live, but we can certainly do another one for any colleagues who are interested. But there are two types of fibers. They vary in thickness, but there's the way the laser energy comes out of those fibers is different. There's one that's a cone-shaped one, so the the beam is coming out in a 360 fashion, and there's another one which is a linear bare tip fiber, which was the conventional, very commonly used laser fiber for these kind of interstitial treatments. Now, when you are delivering laser energy into the skin and it is just fat and water, which are the main targets for this wavelength of laser, so this laser is a 1470 nanometer laser, there's no problem, because when it encounters fat and it encounters water, that's great because the energy is absorbed, the laser energy is absorbed. However, if it comes into contact with something other than that, like a filler, whether that's a hyaluronic acid based filler or whether it's a permanent filler made of some other component, then it's unpredictable as to how the laser energy is going to behave in terms of its direction of flow. So that could be dangerous if you've got nearby surrounding structures which are sensitive, such as nerves. And we will go into a little bit more detail later about kind of the possible side effects, possible complications of Endolift, and we'll touch on that a bit more. But ultimately, if you want the laser energy to be delivered here, but you've had jawline filler in the past, there's a possibility that, depending on the material that's been used with the filler, it could retract the laser energy and it could change the direction of it, thereby causing delivery of laser energy somewhere where you don't want it. And so if there's an important structure, that could be compromised. In terms of patients having Endolift and then thinking about dermal fillers and botulinum toxin treatments, I would say that it's worthwhile just waiting until the patient's swelling, redness, if they had a bruise, if that's settled down, then absolutely fine to continue and go ahead with Botox and dermal filler. Really, what I envision and what I do in my practice is I use this very much as a combination treatment. I use it alongside cosmetic injectables, sometimes even doing them on the same day, particularly if it's a different area. If you're doing an upper face 3-area Botox, you can by all means do a lower face Endolift or a chin treatment. But just bear in mind, practitioners listening, just bear in mind about kind of the implications of how the laser energy and the direction changes potentially if you are using them together.
Yeah, that's a great point. So while you were talking, I could see there was a few questions coming in. So one of the questions is on, can it be used on the body? And very much so. So, my experience is mainly above the neck. I tend to do all my treatments above the neck. So again, I'm going to defer this one over to you, Priya, about your experience on body treatments with the Endolift.
Great, yeah. So absolutely, Endolift is fantastic for face, and it's very popular for face, but it absolutely can be done for body treatments. The type of body areas that are commonly treated include the abdomen. So a lot of patients, after they've had pregnancy, they might find there's some loose sagging skin, which might be amenable to some tightening. Also, any kind of stubborn fat pockets in the abdomen, that's a possibility for treatment. Patients coming in with a concern about bingo wings, so kind of medial arms, upper arms, but also the inner thighs, the inner knees, the ankles even, are all possible treatment options for treatment areas, for Endolift. I have personal experience in using the Endolift on the abdomen and inner thighs and inner knees. And I've actually seen some exceptional results. I will share those with you all on my page in due course. But the most important thing to say about body treatments is that you have to select your patient carefully. If there is too much fat, and if the main concern in the body treatments is fat melting, then please do treat your, select your patient carefully. If there is too much fat, and we have a very crude way of measuring this, and it's simply by a pinch test. So how much fat can you pinch between your fingers? In the face, we generally say, we guide our parameters on the device settings according to how much fat we can see. So, if you have a training session with me, then we'll go through kind of what settings you use for what amount of fat. But in the body, there are certain cut-offs for, if a patient is over a certain BMI. So certainly over 35, a BMI of over 35, I would say are not suitable for treatment. It's really important as well, if the main objective of doing a body Endolift treatment is to reduce fat content, then we must look at lifestyle measures just as importantly. So, I say to patients, yes, we can remove this stubborn pocket of fat, whether it's from your abdomen or, from the inner thighs or the inner knees, but if you were to just then go away and adopt an unhealthy lifestyle, increase your fat content in your diet, not exercise as much as you're doing now, then of course you're probably going to see a reaccumulation of those fat pockets. So we're not trying to work magic here. What we're trying to do is assist you with any stubborn fat, but ultimately it's just as important what you do when you leave the clinic as what we do in treatment. So all of this is part of the consultation. It's really important to kind of drill that home to patients so they're not unhappy if they don't see a lasting result.
Yeah, so a couple of things just to add to that. I think you did that, very concisely. So you said something earlier about HIFU, and I think you're spot on. HIFU, for those of you who are not aware, is high intensity focused ultrasound. And for quite some time, along with something else called radiofrequency, which is just a form of medical electricity, these were really the mainstay of tightening the face. Now, there are some people who do get good results with those treatments. I'm one of them. I get exceptional results if I get some HIFU done. So I can certainly, speak to its efficacy. However, by and large, if you sample 100, 1,000, 10,000 people, you're going to get results like this, which is the smallest group are going to get an outstanding result. Then you're going to get people who get a good, average, poor, and this is important, zero. Okay, so with some of the non-invasive treatments, it's always worth bearing in mind there will definitely be a bunch of people who get literally no discernible result whatsoever. Now, that might be because we often use these treatments to press the pause button rather than rewind. So, what I mean by that is, as we're aging, it may not be that the HIFU makes us look 5 years younger, but it might be that with regular HIFU treatments, we can stay looking how we are so that in 5 years' time, things have paused. So that's one thing. But the thing about those external devices is I found that they were good. Patients liked them. They really loved the fact that it was non-invasive. They loved the fact that there's no downtime. And the ones that got a nice result, it was happy days. But I think so this Endolift is definitely significantly more effective than those. There were questions earlier about, just normal liposuction and some of the more established devices that people will be familiar with in the UK, face height, etc. I think the main difference here is, as Priya said at the beginning, there's no suction. We're not sucking anything out. So, if somebody had large pockets of fat that actually needed to be sucked out, then that is, maybe a different patient cohort. But I think the best thing you said there, Priya, is the whole thing you said about lifestyle, because I think I've got two real issues. So in my clinic, what happened is, up till the Endolift came, the audit showed that if I saw, let's say for argument's sake, 100 patients all coming in for jowling, about 10 or 15% were referred to the surgeon, because after my chat and they realized that a surgery would be their best option, that's what we did. So if they're willing to have surgery, they wanted to have that, I would refer them on to my 2 or 3 colleagues who, specialize in that. And if they were suitable for either the HIFU or the dermal fillers or the Botox, they would have that. But if they weren't, we did nothing at all. I would actually say, look, I don't think there is anything we can do. And I certainly don't want to just, try it out, because, there is expense and it is a procedure. Now with Endolift, that amount of people that I say no to has dropped significantly. But what's important is it hasn't dropped to 0, and it never will, because none of these procedures will take the place of lifestyle issues. So, and I think that's really important. I'm very loath to offer these treatments if the reason somebody has found themselves in that clinic in the first place is because of unhealthy habits. Because what's going to happen? A year down the line, they're going to be exactly where we started off from. If somebody says to me, this treatment could be a kickstart, it could be the motivation I need to really do it, I think that's different. And if people are prepared to make that change. I've had people following not just this treatment, but other treatments, give up smoking. I've had people take up exercise. I've had people who've significantly changed their lifestyle for a better, with all the benefits that brings with it. But I think if somebody is honest and they say, look, I've come in for the shortcut, I'm going to be honest with you, I've got no intention of, doing anything differently to what I'm doing now. So I was hoping you could do this. I would probably say there's no point, for the 6 months you're going to enjoy the result. Is it really worth, going through everything? So I think that covers all the different sort of scenarios there.
Yeah, absolutely. And just to touch on what you mentioned with regards to liposuction, so you're right, we're not suctioning any fat out, but there is a question here by Dr. K about whether you can use this post liposuction. Now, that's really, really an important thing to mention, is that yes, absolutely. So for those patients who, for example, who are over the kind of threshold BMI that I adopt as a protocol in our clinic, then yes, that is certainly a treatment option. That is possibly the first part of their journey. So along with lifestyle measures, we could refer them for laser-assisted liposuction or surgical liposuction. And then after a period of time, once they have healed, once that area of the body has healed, they can certainly by all means come back and have a skin tightening, plus a little bit of additional stubborn fat pockets that have maybe remained, can come and have an Endolift treatment for that. So yes, absolutely, in answer to your question, Dr. K, we can do that. There are a couple of other questions on here. One was about eye shields for periorbital treatment. What's your take on that, Dr. Tapan?
Well, I am
whether the use of eye shields is mandatory. What do you think? Okay,
so I was looking at the academy, the on virtual academy that Eufoton did, and the experience is divided. I'm not treating around the eyes at the moment. I mean, I will treat festoon area, malar mounds, which is, obviously extraorbital. And for that, I'm just using external shields, whatever. But I see no reason. I mean, I'm very, very comfortable using, metal shields for, CO2 resurfacings and that type of stuff. But I'm not at the moment venturing into the upper eyelid area, into the brow area or anything like that. So as Priya may have mentioned, there are, 2 different types of fiber, but there's many different sizes of fiber. So in terms of the type, it's how the energy comes out the end, whether it's radial or linear, but you know, there's a 200 micron, 300 micron, 400. So the tiny little fiber, the 200, you know, we use around the eyes. So at the moment I'm using, you know, external eye shields, but just although we think about festoons, malar mounds as being an eye related issue, the anatomy is really cheek. And so that's what I'm doing now. Yeah.
Yeah, agreed. Absolutely. It's from the people who have trained me. So, you know, I'd like to give them a bit of a shout out, actually, Dr. Ricardo Forte, Dr. Roberto Della Vanzato. You know, these guys who've been doing this for a very long time, who do a lot of periorbital treatment. You know, it's certainly not mandatory to use an intraocular eye shield for this treatment, for periorbital treatments. But you know, if the clinician feels that they are competent in the use of them, and you know, there's an additional layer of consent essentially, because there's potential complications from the eye shield itself. So as long as that's made very clear to the patient, then yeah, there's no reason to not use them, but it's certainly not mandatory. There was also a question about contraindications. So I think this leads us quite nicely onto one of the things we wanted to talk about on our agenda. So I was going to ask you to Tapan, what when you see a patient who comes in to the clinic and you recommend them Endolift, what exactly are you looking for in a patient? Who is the ideal candidate, and what sort of conversation do you have with them about what to expect from the treatment, whether there's, you know, what sort of side effects, complications are you consenting them for?
Excellent. So, and that will tie in with a few other things that came up. I saw something about, you know, is it contraindicated in thin faces, for instance? I think, again, it's difficult to explain the treatment for those who haven't seen it. But without getting too technical, the important thing to understand is that we can adjust not only the fiber that we use, so whether the energy comes out the end, so this is the fiber, it comes out that way, or it comes out more what we call radially. So that's one thing we can do. The second thing we can do is adjust how much energy comes out. And the last thing we talk about is what we call the T on or T off, which is how long the energy is there and how long it's switched off. And this happens, you know, in a fraction of a second. So the point we're making there is there are different tweaks that you can do on the system when you're actually using the fiber. Now, what I think is quite unique about this system, and you know, this really is awesome as far as I'm concerned, is I haven't really met anybody I couldn't treat yet, with the exception of if somebody has just got a bit too much fat. Okay, so I do feel there are some people who have crossed that border where non-surgical treatments would be effective, and they're probably better off having a surgical consultation. So extreme laxity, extreme what we call fatness, bilaxity, if the skin is really hanging down, I would argue they're probably better off, you know, with more conventional or more aggressive approach. But after that, even people with very thin faces, as somebody asked, but who have wrinkling or what we call this accordion lines, so sagging skin, some of those patients get the best results, because actually there's not many things that you can't do in a patient like that, because they tend to be depleting everything. So they tend to have a bit of depletion in the bone area, in the fat, in the skin. So it may be that multiple treatments are required in terms of, you know, you need the Endolift. After that, there may need to be some volumizing filler, and that's fine. Now, the opposite end of the spectrum, if somebody is got a little bit of extra fat, so, you know, fat around the jawline, under the chin, you know, in the fold here, then they're a great candidate too. And that's what I like about it. So within that spectrum of patients, which I think encompasses pretty much most people I see, I don't really have any people that I wouldn't treat. Now, there's always that standard, you know, pregnancy and breastfeeding thing, you know, accepted. But a couple of other things. Somebody asked a question earlier about keloid scarring. I definitely would personally not recommend a treatment like this for someone with, you know, significant keloid scarring. Because the problem with keloid scarring is it's not predictable. And there are patients who, if you don't know what keloid scarring is, you may have seen it and not known it was keloid. You'll see people walking around with very huge scars, almost like little growths. And they can be anywhere, but they're typically behind the ear, they can be on the chest. and they can complicate any wound in people who are predisposed. Now, the problem is that sometimes people get it just from earring piercing. It's one of the commonest causes. And the nature of this treatment is such, because we're treating it a lot, that if somebody were to get keloid scarring, then, you know, it could be quite significant and quite traumatic. But the other type of scarring that a lot of people have, which usually makes treatment problematic, which is acne scarring or chickenpox scarring, well, Endolift is really good for that, because the subcision, and by subcision we mean the freeing of the skin with the laser fiber, often helps that. So for instance, I will sometimes get people who traditionally I would have done filler here in this region, but you find that the cannula barely moves because that scarring is like making that area under the skin like very, very tough to get through. But yeah, very tethered. But you can actually see with the laser fiber, it starts breaking down and improving almost, you know, in front of your eyes. So that works very well. And then I can just see somebody asking about cellulite. And again, I think you've got a little bit of experience, and I think worldwide there's lots of experience to show that as long as it's not a very aggressive or severe cellulite, it's actually a fabulous treatment, right?
Absolutely. And hi, Dr. Haydarian. So the person asking this question is actually an expert on subcision with Endolift laser. So thank you so much for joining. Yes, so Endolift can be used for cellulite, but you have to assess the severity. So, you know, you can use a grading system, and if it is very severe, then it's likely to help a little, but not completely resolve it. So that's, again, managing patient expectations are really key here. I haven't got any personal experience, aside from one patient who, as a byproduct of doing a thigh treatment, noticed an improvement in the appearance of cellulite. So as you know, you and I both do more body treatments, I suppose we'll build up a bit more of a an evidence base on how well it's working, and hopefully we can all kind of start to share in our knowledge and experience and expertise on issues like this. So really kind of trying to cast the net wide and branch out into other treatment indications with Endolift.
Sure. There was a question there from somebody who I know follows me, and she's asked it twice, so I must answer. And the question was, what about heavy skin? So I don't know about you, but this is the answer I give to that. To me, it's not really heavy skin, because interestingly, skin doesn't change much from person to person. It changes within the face. So, you know, the eyelid skin here is the thinnest skin on the body. This is also very thin skin. This is very thin skin. This is thick skin. But the difference between men and women and people from different races, and, you know, even between, it's not, we're talking microns of difference. When we look at thick skin, really, usually what it is there's a bit of fat there as well. That's really why people may look heavier set. There's no doubt that, you know, some people have very, very, what we call atrophic skin, and atrophic skin means that it's kind of either shrunk down a little bit, dehydrated. So to me, actually, it's those patients with thick skin, which usually means it's kind of a little bit stretched and a little bit fuller. My experience is they get the best result no matter what you do, because the tensile strength of the skin means if you put filler, it lifts. If you do HIFU, it tightens. If you do Endolift, it tightens even more. So, you know, to me, the dream patient, you know, if you ask me what's my ideal patient to treat here, I would say somebody with decent thick skin, as we call it, but it's not thick skin, it's just, you know, a little, but with a bit of fat in the fold here, in the fold here, in the jowl, under the chin. And I think that's the kind of person that I would, but the great thing about this is, even if I get, you know, somebody hollow with just, you know, really, really thin skin, they still get a nice result because the skin tightens.
Absolutely, and that's why the LASEmaR 1500, which is the device that we use for the Endolift, is so intuitive. Yeah. Because you, as a practitioner, as you gain familiarity with the treatment and the device itself, you can actually tailor your treatment to make it totally bespoke to the patient in front of you. So I agree, absolutely. That would be my ideal candidate as well, Tapan. But in my experience, what I have found is that patients in the slightly older age category, somewhere between 50 and 65, who have potentially got very thin skin and hypertrophy of some of their fat pads, they actually see a very good immediate tightening result, which holds. The only thing I'm yet to see, and which I will feed back on over time, is to see whether the patients with thick skin versus thin skin, who has more longevity with their result. Because based on what you just said, the sort of theoretical underpinnings of what you just said, Tapan, I think hold very true for patients with thicker skin, most likely having slightly more longevity with their treatment outcome. So that's yet to be seen in my experience anyway. I'm sure, you know, we could ask some of the veteran Endolift practitioners about that. But yeah, it's a really good point, a really good question.
A thought that came to me, and I wonder if you agree with this, because it's when you were describing that interposition of Endolift and liposuction, would it be too simplistic to say that liposuction is a procedure that is primarily for the fat, which has a secondary effect on the skin, whereas Endolift is more a skin procedure which also treats the fat? Do you see what I mean? Yeah. And I think because when we're looking at tummies, for instance, if the main thing is a lot of grabbable fat, I would argue that patient's going to be better off having traditional lipo. But if, as we often see, and these patients have been to doctors who've turned them down because the main issue is crepey skin, thin, sagging skin, then this type of procedure is just spot on, right?
Absolutely. You know, when it was developed, when the Endolift was actually developed, its primary objective was skin tightening. What they found is through a lot of research and development, and you know, a lot of iterations with the device settings, they found that we are achieving a degree of fat melting, which is why it was almost a secondary objective of a treatment. So I certainly wouldn't be seeking out a patient just for fat melting with Endolift, because yes, agreed, they should likely be referred if that's their main objective to maybe a more definitive, not definitive, but a more permanent solution for that. It was sorry, Tapan, there was a question or a comment actually earlier when we were talking about that. I mentioned that if a patient has got maybe a high BMI who is not suitable for Endolift straight away, or they want to go away and lose some weight first, maybe think about doing laser-assisted liposuction, that sort of thing. Really important to mention as well that the LASEmaR 1500 device, for which you can, which is what you use to do the Endolift treatment, is actually a multifunctional device which can be used to do laser assisted. Of
course, yes.
So I hadn't forgotten whoever made that comment earlier. Sorry, you're absolutely spot on. Yes, you can use the Endolift, the LASEmaR 1500 for that, but also it's got a non-ablative fractional light scan handpiece as well, so it can be used for fine lines and wrinkles and resurfacing the skin. But it can also be used for, you know, depending on the different handpieces that you use, vaginal rejuvenation, endovenous laser treatment as well. So it's got, you know, lots of applications, which, you know, if you are interested as a practitioner, then please do look at Eufoton's website into the different applications of the LASEmaR 1500.
Just to remind you, we've got, I think, about a minute left. And as I found out the other day, Instagram's brutal. It just cuts. It just cuts at the hour. Yeah. So just in case we do get cut off, from my point of view, I'd like to thank Priya for the very kind invitation, and Endolift UK and Eufoton for organizing this Insta Live. Most importantly, all of you, you know, it's absolutely humbling to have so many people on a Monday evening tuning in, watching. So thank you for making that interactive and asking all those questions. I hope it was useful. Priya, thank you very much.
Thank you so much, Dr. Tapan. It's been really nice. This was actually my first Instagram live, so I hope it wasn't. I hope I was clear, and I hope you guys found it useful. Agreed. It was so nice to see so many of you joining, and thanks for interacting, asking lots of questions. I just want to end by saying, if you guys are interested in learning more about Endolift, or you want us to do more of these sessions, I don't know about you, Tapan, but I've been very happy to kind of do more bespoke ones on different aspects of Endolift or the LASEmaR 1500. So please do get in touch via DMs or whatever.
Do you know what we should do? What we should do when the restrictions lift, we should just do a live case together on Insta Live. Yeah, I think that'd be really good, because I didn't see why we couldn't do that, you know, just in the clinic, and we can just set it up. And you know, we can do it in pieces. So I think that could be cool. Yeah,
we'll do that. Thank you so much, Tapan. This was great. Really enjoyed it.
Pleasure's all mine, Priya. Thank you, as always.
Okay, I will save this now when I end it, so everybody can watch it a little bit later on as well.
Wonderful. Okay, I'll log out now. Thank you.
Bye. Thanks, Tapan. Bye.